This is Dr. Crawford, orthopedic surgeon in Hawaii. We're going to be going over some injury treatment, prevention, and some overall guidelines on how to treat some injuries and pain. So please don't let this supersede you. If you think you've been really injured and you need emergency care, please call 911, go to the emergency room. I'm here to talk to you about shoulder injuries and shoulder pain issues that we see very commonly in our practice. The shoulder is very unique. It's the most mobile of any joint, especially a major joint in our body, and that puts it at risk of having significant injuries, being so loose. And then as we get older, we see a different injury pattern. But shoulder injuries are very common, along with overuse type injuries, especially in your swimmers, overhead athletes, and things like that. But it can happen just in patients with light duty activities such as desk jobs and computers and things like that. In general, when I see a patient come into my practice, what I've learned is that approximately 90% of those patients fit two general patterns when they see me. We can generally break those patterns up into your adolescent to middle-aged, say 40, 45-year-old patient. And then the second pattern would be in your middle-aged to older patient, because different structures are getting injured and different presentations are happening. So those are the 90%ers. Obviously, there's a lot of crossover, especially in Hawaii, where we have a very athletic middle-aged population, which I hope I'm still one of them, but they get injured just like sometimes an adolescent can get injured. So there's a lot of crossover, but we're just going to talk about those 90%ers and some details about it. So in that younger category to middle age, the number one thing that we're treating in the shoulder is labrum injuries. Labrum injuries. Labrum is a very tough piece of cartilage that coats the joint, seals the joint. It's very important. It's densely innervated with nerves, so when it's injured, it causes a lot of pain. And so that's the number one injury that we see in that category, if it's significant. If it's just a shoulder tweak, which is hopefully all you're dealing with, that's going to be a 1 to 2 week turnaround, usually for a shoulder contusion or a sprain that's mild. But if it's significant and you know that something happened, that's the number one structure we're worried about in that group. The number one thing causing that labrum to get injured in that category is instability. We don't see that in the knee. We don't see it in the hip that much, very rare. But in the shoulder, it's the most commonly dislocated joint. A dislocation is where the ball in the socket, the ball comes completely off. A subluxation, where it tries to come off, tears the labrum, comes back. So dislocation and subluxation in your shoulder cause torn labrums all the time. And we see that pattern exist. It's an unfortunate pattern because a lot of labrum tears don't heal on their own, and that's unfortunate that a lot of people deal with that. So that's the main concern for the younger category. In the middle age to older, we're dealing with rotator cuff problems a lot. Thankfully, arthritis, it does happen to some people, but just not nearly the rate that we see in the lower extremity, the weight-bearing joints. So the number one thing that we treat in the 50 and up category is rotator cuff problems, biceps problems, which goes right along with rotator cuff. So those are the two patterns that we see. What I thought I'd do is go over kind of the 5 questions I get asked the most about patients' shoulder when they come in and see me. And then we're going to go over to some hands-on stuff with Bart Kellner, one of Hawaii's best physical therapists, to kind of lead us through some early shoulder rehab. So we're going to cover these 5 questions that I get asked the most in my practice. Number one, I would say, is I'm hurting and where should I go? I've been injured, or I have an overuse injury, I have shoulder pain. Who's the best and where is the best to go? Obviously, if you've been really hurt, the emergency room, the urgent care. If you're one of those 90%ers where you tweaked your shoulder, maybe it feels a little loose, or you're injured and not getting better, obviously the best would be a shoulder specialist. That's not always available, but there are ways to do it through your primary care provider. In urgent care or ER, they would refer you to a shoulder specialist. So as soon as you can get to them, I think that's more ideal if you're dealing with something significant and not just a little bruise or a sprain. The second question is what kind of things can I start doing? What kind of rehab? How do I make my pain better now that I'm in pain? So that's why I thought we'll go over that with the physical therapist. Have Bart Kellner here teach you some of the things that I think are safe. The shoulder loves to get really tight after an injury, and so there's some dynamic and static ways to start getting your shoulder feeling better, get the range of motion back, so we're going to cover that. The third question I get asked a lot is, what did I injure? What is causing all this pain? We touched on that earlier. The labrum is the most common structure, I think, injured with a significant injury in that younger category, and in the older category, more the rotator cuff problem and things like that. But there's certainly crossover there. That leads into the fourth question, which is, do I need an MRI? I get asked that a lot, and it's really a case-by-case basis. When you get an MRI, it's like a 4K, very high quality picture of the joint, and you can see what's injured in over 90% of the cases. So if you're having a problem, the injury dictates that you should get worked up and this isn't getting better, or you're concerned about a real injury, usually the shoulder specialist at that time will get an MRI, and it is very good test at telling us what's going on. Not perfect, but very good test. The last question that I get asked a lot is, how long does it take to get better? Obviously, it really depends on what you've injured, but keep in mind that a labrum injury in a young active patient, the reason why sometimes it needs to get fixed is because they don't heal on their own. So if you want to give it a first few weeks to see how it's healing and try some of this rehab, and it's not getting better, then that's even more suspicious that you might be dealing with something that is significant. If an injury gets better in a week or two, that's a really good sign that you didn't do something really bad that's going to heal up, and that the labrum is probably not damaged. So that's just in general. There's certainly some exceptions there. For older patients that are dealing with rotator cuff problems, they don't come in general right away. They're dealing with pain for months, especially at night, months and months, and weakness and pain. And so those folks come in, and they could be the first ones to tell you that things are not going to heal overnight. In fact, they persist. So those are the ones that usually are in my practice. So hopefully you heal up right away, and you're not going to be dealing with that. And some of this rehab that we're about to show you, I think is a really good place to start. So we'll head over there now.
Hey, I'm Bart from Physiotherapy, and this is Jono. He's our athlete for today. We're going to talk about shoulder pain. Dr. Crawford talked about various types, labral tears, rotator cuff. This is basically, you've done something, your shoulder hurts, and you want to do something to make yourself feel better. We always start with a real simple exercise. It's just we call it shoulder retractions. You can do it anywhere. You can do it sitting, standing, or laying in bed. The first thing we tell people is think about your chest. So he's going to tilt his chest up, and then he's going to roll his shoulder blades back and down. If you think about your shoulder blades are like triangles. So you're basically trying to take those bottom points of the triangle and pull them together and down. And you can just rep this. I tell people usually do 25 of these and just repeat them all day long. Because basically what we're trying to do is open up the front and get the back firing. Okay? This motion that he's getting into and this position that he's getting into is going to be the basis for all the other exercises I show you. So get good at this one. Okay? The second exercise, I'm going to just have him stand up over here. All this is extension. So he's going to stand in that position. He's going to pull his shoulder blades back and tilt his chest up. His arm is going to be locked and loaded. So everything is tight in this. Okay? So I don't want your arm weak and loose like a noodle. So everything should be on. Basically, I tell people, keep your fingers low like they're on a table, and you're going to pull your fingers back on that table as far as you can, and then come forward. So his shoulder blade is coming back as his arm is coming back. So you notice that the point of his shoulder is not tipping forward. If that happens and he tilts here, you're not opening up anything here. So basically, again, just pulling back. I tell people to just rep this for about 30 seconds. Okay, third exercise. We're going to go into an external rotation, just an isometric. So we need a wall or a door. Basically, your arm is bent at 90 degrees. Your chest is up, your shoulder blades are back in that same position, and now he's just going to push into the wall. Okay, this exercise basically fires off your posterior rotator cuff muscle that really helps with stabilization for your shoulder. Get some blood in there, it's going to help make you feel better. Again, this one, hold for 30 seconds, rest, repeat it about 3 times. The last exercise before we get to a stretch is, we call it like a slow chest, but really it's a push-up. You can use anything, kitchen counter, a desk, a door. Basically, you want to just be in a push-up position, and then it's going to be a 10-second. We tell people to pull down. Okay, the edge of whatever you're using should be lower than your chest line. As he's pulling down, he's squeezing his shoulder blades. Once he's down there, he's going to hold for 10 more seconds, and then he's going to come up easy. Now again, you're going to go to where your shoulder lets you go, so go about halfway this time. If it starts to hurt right about here, stop right there and hold that. Then come out of it. I tell people initially do 5 of those. The last exercise, if you're feeling really stiff, it's just an external rotation exercise. You can use a door or a wall. Okay, he's going to put his arm up. We're going to start it a little bit lower, so maybe not quite 90 degrees. He's going to then rotate away from his arm. Okay, again, so he's trying to open up his chest muscle, which causes a lot of problems with painful shoulders. Okay, after holding anywhere from 10 to 15 seconds, he'll turn back. If his shoulder lets him, he can move up and then do it again. And you can change levels 2 or 3 times with this. These 5 exercises should at least help you feel a little bit better until you can analyze what's really going on in your shoulder.
So you heard some background about the injuries and things that we see, and then you got some good rehab tips, and hopefully that can help you stay out of injuries way and you're back on the mend soon.